Hello, wherever you're joining from, I'm going live today with Lital from WholeNest, and we're going to be talking about tips for recovery following a C-section. Having had a C-section after twins myself, I'm really excited to hear what she has to say. So let's get her in now and we can discuss all. Lital? Hello, nice to see you. How are you?
Good, good. How are you? Nice to see you.
Very well, thank you. Can you hear me okay?
Yes, I can. Can you hear me?
Yes, fantastic. The internet was being funny, so I just wanted to check. But thank you for joining me today to discuss C-section recovery tips. And I was just saying that I have twins and I had a C-section for my twins, and I found the recovery really, really difficult. So I'd love you to tell us a little bit more about yourself and WholeNest to start with.
Okay, great. So first of all, thank you so much for having me. My name is Lital. I live in New York City with my family. I have experience in the healing and wellness field for 20 plus years. Started my studies in Chinese medicine and shiatsu therapy, and I trained to be a Pilates instructor, and I studied something called body mind balancing, which is the connection of the body and mind, how to connect and locate stuck emotions that inside our body and the internal organs, and how to release them. So I was teaching, I was working with people, and then when I had my children, I was actually introduced to these really wonderful natural recipes for postpartum care, and I made it. I made them, and then I shared them with other recovering friends, and I saw some amazing results. And then this is how WholeNest really was born. But the product is kind of like an extension of what I was doing before. So it's like the understanding of what it means to heal, because healing is a natural process, but we want to help it. We want to speed up the process of recovery. So yeah.
Amazing. And in terms of tips, well, before we go into the tips, what are the reasons that people may have a C-section?
So there are a few reasons, right? Well, I'll name a few of them. So the first one would be abnormal fetal heart rate. So in the hospital, you'll be monitored. Your heart rate will be the baby's heart rate actually will be monitored, and the normal heart rate would be from 120 to 160. And then they're not, even if it's below that, they're not right away will rush you to a C-section, but they will increase oxygen or fluids. And if that doesn't work, and if they actually see that the baby is in kind of like a danger, then you'll go to cesarean procedure. The is abnormal position of the fetus during birth. Problems with labor. Let's say the water broke and there's no progress in the opening, the cervix is still closed, and they see that time is running out. The other possible reason is placenta problem, kind of like placenta previa, when the premature detachment from the fetus, it's known as a abruption. Then you rush to get a C-section. The other thing, certain conditions in the mom, like high blood pressure, diabetes, HIV, and so on, or active herpes, sores in the mother vagina or cervix. So we don't know. We know it's extreme, and we don't want to pass it to the baby. Twins, like you had, or multiple babies, and or previous C-section. We know it's typically, I mean, it's possible, but it's typically hard to have vaginal. It's more challenging to have a vaginal
Thank you.
birth after a C-section. But overall, I must say, and this is where really I want to take this conversation, this direction, this conversation, there are many reasons why of why we need to go through a C-section, but just to have in mind that every baby, every child, every soul that is coming to the world has its own journey, right? So if it's meant to be C-section, that's what it will be. But yeah, but these are all the technical reasons.
Mm-hmm. Thank you. That's really good to know. And what should people think about before they have a C-section if it's planned? Is there anything people can do to prepare?
Right, for sure. So it's very important, first of all, to discuss with your healthcare provider what to expect, right? Exactly what you're about to go through and so on. But again, even if you know exactly what is included in C-section, you want to keep in mind, you want to connect to the end result. And the end result is that you are safe and the baby is safe. That's really the best preparation, I would say. The other thing is stocking up on essentials. Keep taking your prenatal vitamin. Make sure your house is in order. Prepare everything you know that you need to have for after for after the birth. The other thing is make sure that your body is balanced as possible. If it's pelvic floor exercises, even though it's a C-section, the more balanced the body will be and the optimum health, the better recovery will be. Aim for a balanced and healthy body. You want to also discuss with your doctor or your midwife about all the supplements and vitamins that you're taking. You will be required to fast for about 8 hours before or so. And another very thing is affirmation, meditation. Connect really with your, before you go to sleep, be like, let's say a month before the procedure, or let's say if you reach the 9th month, connect with your baby and with this whole process and work as a team, right? Make connection between yourself. Say to yourself, even find in your own words, I trust my body. I trust me and my baby work as a team. I trust the medical staff, right? So you want to really kind of like program yourself so the body and the mind will work together.
Mm-hmm. That's such great advice. Thank you so much. Because you're right, preparing before means that when it's happened and, you're having morphine or whatever drugs that you're having for the pain afterwards and after the operation, which is a big deal, you want to be making sure that when you get home, you've got everything set up, etc., so that you don't need to start getting up and moving too much and feeling like you need to host people when they come over, or vacuuming, or all of the things that I did, which I should not have done straight after my C-section.
Exactly, because we tend to forget. I mean, we think we are super women. I mean, we are, but this time at least to give ourselves a little break, like to give ourselves the time and space to recover.
And how long do you think it should take to recover from a C-section?
So full recovery, I would say from 6 to 8 weeks. Yeah, it's typically longer to recover from a C-section than from vaginal birth.
Mm-hmm. Yeah, so if you're experiencing pain or discomfort for months, then it's something that you need to get checked potentially.
Oh, absolutely. So really there's a difference between vaginal labor and C-section, because C-section is somewhat a surgery, right? So on top of all the recovery process that anyway is taking place, also even if you do a C-section, like vaginal bleeding or uterus cramps, all of that is happening, as well as like the recovery from the procedure itself, which you need to take care of the wound, you need to make sure it's infected. Let's say the recovery usually is longer. Really need to rest as much as you can. So everyone said that it's not always practical. We also want to be practical and authentic. You probably you won't be able to lift heavy objects. Your baby is totally fine to lift, maybe not in the first few days, but yeah, you need to exercise right away. You need to be cleared for probably from a health provider. So it's a process. It's a process. You also want to excuse me, to really focus on very good diet, lots of protein, of healthy carbs, of leafy greens. It's not the time to think about losing weight or go back to where you were before. Really, the focus should be healing your body and giving all the energy you can for your new baby.
Love that. Thank you. And how you mentioned that it takes more time to recover from a C-section versus a vaginal birth. Why is that the case?
It's the case because like unlike the vaginal birth, there is they kind of like cut you open, right? They make a small cut in the uterus. So it's a procedure. It's a surgical procedure. And so not only that you need to recover down there, you also recover up there, right? If it's pain management, typically people say that it's simply painful where the scar is. So it's just it's a different because it's a surgery. We need to take care of that. So two things are going on.
Mm-hmm.
But the good news is like you will be better, and it just takes time.
The thing that I was most unprepared for or didn't really realise when having a C-section was the fact that you still have a lot of postpartum bleeding from your vagina afterwards, as well as obviously the recovery of the wound itself.
That's right. Yes. You will have, I know some people like they're kind of surprised that it's bleeding after, but yes, you'll have, it's a natural process of the body, the bleeding of the uterus and the vaginal bleeding for about 6 weeks.
Mm-hmm. Thank you. And medication, healing support. Tell us a bit more about it and what people can do to support themselves once they've had a C-section.
Right. So it's one of my favorite topics. After years of exploring the whole idea of the body and mind, and after going through something myself right now, I don't think I shared with you, but I recently fractured my leg actually.
Oh gosh.
Yes, and I had through like really recent, like a few weeks ago, I had to go through surgery and all that. So this is not postpartum. However, I'm sharing this because I really noticed that every time I put my mind in a place that I close my eyes, visualize my leg is healed, is completely straight, and I'm walking again. I see that my progress is so much faster than I do, like for example, the PT exercise or even general recovery, right? So once it's like our mind is so powerful and it's kind of like a muscle. The more we trained the mind to think a different way, to think a certain way, this is who we become. When we meditate, this is what we do. We focus our intention into healing, into recovery. The body will have to follow, if that makes sense.
It does.
So usually, because of belief system or because this is human nature, there's kind of a connect between the body and mind. So that's why we want to make them one. That's why meditation is so powerful. What you put into your mind and send to your recovery, to your baby, to yourself, to really every cell of your body, and lots of compassion and lots of appreciation to what your body is capable of bringing life. I mean, wow, it's huge. Like who cares about it's huge amount of appreciation and compassion and good affirmation will really do the trick of a fast recovery, right? So I didn't go myself through C-section, but I hear it from many women of how meditation and guided imagination was so powerful for them, and I'm experiencing it myself now, hands-on, because of my recent injury.
So with your healing circle, how does it work? How do people join? The link's in our bio, but tell us a little bit more about how it works and what to expect.
So the healing circle is a guided meditation done usually in 3 parts, and usually choose the topic ahead of time, let's say recovering from C-section or postpartum, or someone about to go through another challenge, right? So the whole idea is, and researchers actually show that and support the fact that we meet together as a group and think of someone else's recovery, the results for them would be much better if someone is just thinking about themselves. So that's the idea. So the first part, we are thinking about ourselves. I'm guiding a meditation. The second part is inviting people to the circle. They don't physically need to be there. We are working on them remotely and focusing on their body, on their recovery, on healing. And after we cultivate all this beautiful healing energy, we're sending it to the world. And often people say, oh, but I don't know how to meditate. You don't need to know how to meditate. The instructions are really simple. You just need to be open, really.
Okay.
Open to receive and open to share, because the more we share, this energy is going through us. So it's important to say we're generating this healing energy, but there is healing energy available. So we are just simply channeling it on ourselves, and on the world.
And is this something that people join with other people there, or is it private? How does it work?
Yes, so usually we do it as a group, 3 people, and you can contact us for that. We can schedule it. It's very powerful, and the effect is usually long lasting. So it's usually in group. Yeah, and it's done by Zoom.
Fantastic. Great. And tell us a little bit about your products. And I just want to say that for anyone who is perhaps about to have a C-section or recently had a C-section, and to look at the whole postpartum healing products that WholeNest offer, then as well as the healing circle, then please head to our link in bio and you can use fertility20 as a discount code. So thank you for that. So yes, please tell us more about the products.
So we have 4 products in total. Before I speak about them and explain about each product, I want to say they're 100% natural. I started, as I said, making them myself in my bedroom here, or bedroom in part of New York City. But then I found a facility that is making really small batches. So it's as if I'm making to maintain the integrity and the quality of the product. There are no toxins, no preservative, very high quality, very ingredients. They're safe for babies, they're safe for pregnancy, and they're safe for breastfeeding. The first one we have called a honey lavender magic. It can be used for about after a week or so. After birth, you simply spread on the panty liner. It helps with swelling, as a pain reliever. And then this product is also multi-purpose. It can be used as a first aid ointment for cuts, for burns. It's really good to have at home. The next one, which is my personal favorite one, is the Wonder Spray. It is made out of a structured water, and it's very high vibrational healing water, and frankincense and witch hazel and other things. It can be used also on the C-section scar, not right away. I wait for a week after it's kind of like not so raw, but a week or so after birth is perfect. You can spray on top of the scar, spray your vaginal area, and then why we called it down up there. It can also be used for as a face mist for headaches. We discovered some really nice virtues with this product. So the Wonder Spray. The third one is to treat very common issue during pregnancy and after, which is hemorrhoids. We call it less than a day. It's also, the base is coconut oil and some other essential oils. It can be used as needed, 2-3 drops in a capsule onto the affected area. And the fourth one is a Go Away Cold. It's a room and pillow spray. To excuse me. Maybe I need that. To use right after, to use in case of a cold or a virus. You simply spray the room or the pillow, and in case of fever, you can rub the chest. It's safe for the little ones, the chest, the feet, and it's a very nice one to breathe in, especially at night.
And people should check them out, check these products out, check the Healing Circle out via the link in our bio. As I said, Lital and the WholeNest team are kindly offering 20% off with Fertility20 discount code, and it can support you, all these products can support you postpartum. So anything else in terms of thoughts about how a partner might be able to support someone who's going through birth, or takeaways?
Sure. So there is something called the triangle effect. In Chinese medicine, we talk about it a lot, that when a woman is giving birth, it's kind of like if she has a partner, there is a triangle going on, that the mother is nourishing the baby and giving it whatever it needs. The first 3 months, baby still feels he doesn't have a separate entity, still feels that he's part of he or she feels a part of the mother. Partner, if there is a partner, is nourishing the mother. This is the triangle in ideal situation, right? So how can the partners support? It's really up to the mother to communicate how she would like to be supported. If it's share responsibilities, if it's even clean the dishes or provide the medication, whatever it is. But it's important, especially postpartum mothers, to communicate that. Remember this like triangle. We're nourishing the baby and we get nourishment from the partner, and eventually it balances out. But we're talking about a period of 3 months, especially after that we need some extra support. So in order to prevent resentment or whatever it is you're feeling, like, just communicate that and remember this triangle. And the other thing I would say, if you can go for vaginal birth, go for it. However, if there's no other choice, you really have to go through C-section, which thank God we even have this option these days, right? I often hear from people, oh, but I really wanted to have vaginal and I have no choice. Do not, please, don't be disappointed. Don't think yourself as a failure, okay? Like I said before, and I want to elaborate a little bit about it, every baby, literally every baby, has its own journey to come to this world. Personally, women who were planning to have a home birth in a pool. Everything was ready for them. Meanwhile, 50 hours later, they were rushed to the hospital for an emergency C-section. So what I often share with the expectant mommies is like, be open. Be open to whatever it needs to happen. The end goal and the most important goal is you're healthy and the baby is healthy, you're safe and the baby is safe. No matter what, the way together is to get there is not as important. That's why we have to keep our consciousness and our mind open to whatever it is. Yes, do I want to have vaginal and no pain and pain-free and no epidural and all that? Sure, that's very nice. But very often, it's not the case, and it's okay. Remember, and even if you have more than one kid at home, for one kid, his path, his journey, it's almost written whether you are a believer or not, to come through vaginal birth, no complications, nothing. And the other child, his path was really to come through C-section. The most important, that you are healthy and the baby is healthy, and we have to keep it in mind. I feel we have to be authentic with ourselves and really work on our mind, because this process of pregnancy, giving birth, is so holy, is so sacred. Really, not up to not so. It's not in our hands so much, but we can control. There's not so much we can control on a physical level, but we can control how we react to. So that's patience, the meditations, the preparation, and it's like, you know what? I'm open. I'm about to give a birth. I'm open to whatever it is. I see the end goal. I see a healthy baby. I see myself healthy. And that's really the most important.
Yeah. In the end, healthy baby, healthy mummy is the most important. Completely agree. Lital, it's been wonderful to speak with you today. I'm going to be in New York in a couple of weeks' time, so I'd love to meet up with you and see the product in person. And yeah, it's been absolutely fascinating to learn more about C-section recovery. Everyone should go to link in bio, check out the products, check out the Healing Circle, and also benefit from 20% off. So thank you so much for your time today.
Thank you so much, Eloise. And I look forward to seeing you in New York.
Definitely. Bye.
Thank you. Bye.